Hey guys, welcome to Front Office Rocks and the Dental MBP coffee chat. This is our second one that we've done. The first one we did last week and had some technical issues, so we had to launch it late. But this is our second one, and we're hoping to keep these going for a while because we have a lot to talk about. So if you don't know already, I'm Laura. I'm the founder of Front Office Rocks, and I'm here with two amazing hygienists, experts in people skills, Christina and Chastity from the Dental MPP. Thank you guys for joining me again.
Of course, thanks for having us.
So let me kind of tell you how the coffee talk started. I have my coffee. I don't know if I told you guys to get coffee. We're on two different separate ends of the world right now. But Chastity and Christina are from the Dental MBP, and they have done some amazing training and webinars with regards to people skills, but specifically what we've been talking a lot about is hygienists and PPEs and how they see patients. And I'm a dental front office manager, and we've had some very interesting conversations about checking patients in, checking patients out, who does what. We're all very active in social media, and we hear that there's a ton of conversation going on. So we thought, why not bring the conversation here and talk about it? None of this is scripted. None of this, we don't even know what we're going to talk about at this point. So we're going to bring it here. So let me go ahead, and Christina and Chastity, why don't you guys introduce yourself just so people know who you are, and then I'll kind of flow through how today's going to work. So Christina?
Perfect. Hi, everyone. My name is Christina, and Chastity and I own the Dental MBP. Like Laura said, we are obsessed with people skills. So we use science to teach people skills to dental professionals. And because we're obsessed with science, we also kind of went down a rabbit hole recently and became obsessed with the science and the evidence behind COVID-19 in regards to our PPE, infection control, and all the protocols that are out there. And we've been following everyone on social media with all your questions that you have with who does what, when, why, how. And we're trying to kind of mix in the science and the people skills and make sure that we can all, when we go back to work, when we reopen, wherever you are across the globe, when you reopen, you have that ability to be able to have conversations clearly and feel confident still in the work that we do and have some sort of normalcy. So I know last time we talked about the check-in process, and we never got to check out. We just kind of went down that rabbit hole and had a lot of conversations about check-in, and it's going to be great to finally go over checkout and what everyone is questioning.
Exactly. And Chastity, can you tell us just a little bit about you?
Yeah, so same thing. I mean, I am practicing hygiene, so we're getting ready to go back into the office. So we're now going through all of these policies and procedures, what we've been talking about, what we've been planning, and what it's really going to look like as it kind of comes to fruition whenever our opening date may be, which is varying for everybody, but really getting that concrete plan together.
Awesome. So to explain how we're doing this or what we want to do, like we said, Christina said, last week we thought, let's talk about the check-in process, because they were talking about checking patients in, of course, taking temperature. And a lot of times I hear, oh, the front office team will do it. The front office team will do it. And not that I disagree with that, but I was trying to show that the front office team has a lot on their plate right now too. So we talked about the pros and cons of clinical team doing it, hygiene, front office. And then we started talking about checkout, and we thought, let's call it to like a half an hour conversation. So tonight or today, we're going to talk about the checkout process, because for a while, checking patients out is going to be different. Like at the end of their appointments is what we're talking about. Now, we're opening this up to conversation. We want this to be live and interactive. So if you guys have comments, please, we have some Priscilla who's monitoring all the comments. She's going to send them to us. Any questions, thoughts, ideas, suggestions you have, if you're open and you've found something that works, that's great. Share it with us. We'll also be doing this again. We've already planned next Friday, the 22nd. We're going to go live again about whatever you guys want to talk about, because this is going to evolve over the next week, next month, next couple of months. So we know there's lots of conversations, and we just want to jump in on that. So let's talk about checkout. Now, I will start by saying I have a very different philosophy than a lot of the hygienists or the hygiene consultants out there and trainers. I believe typically the checkout process should always be at the front desk. I think the front office team members, we know the patients, we know the insurance, we know what they owe. We have the time. The hygienist has a chance to turn over their room, see the next patient. So I'm a big fan of checking out the front desk. But right now, not so much. So Christina, can you start by just saying, what have you heard, seen so far, and what are you recommending, or what discussions are you having around that?
I think a lot of clinicians would still love to continue that model, right? Where the front office, they can just be like, okay, I'm done. And you go to the front and let them handle it because they're the experts in it. What we're struggling a lot with as clinicians is how do you get the patient to the front? Like I've got all my PPE on. I cannot leave this operatory unless I, take off half of it and then leave and have a designated spot where I then remove the rest of my PPE. And then what do? Go back to the door to get my patient and bring them and then have to re-garment up. So it's really this struggle, mentally of figuring out what is this process going to look like? How am I going to make this work? And I think this is where that restructuring is coming into play. And everyone is looking at it from two places, is who's going to schedule next appointments and who's going to collect payment. Do we start collecting payment in the back? Do we schedule all the appointments in the back? And so that's a conversation that I think practices really need to start having, is both of those. So how are we going to do scheduling next appointments and how are we going to collect payments? Because the reality is that's what happens in checkout. And I think there's a lot of factors that go into that when it comes to each and every single practice.
And I want to add to that. I think the third thing I'm seeing a lot of people talk about is how do we present the treatment plan for the next appointment? So clinical, if they need something, we don't take them to the consult room. We don't want the front office person coming back. So Chastity, what have you seen in conversations, or what are your thoughts around checkout?
Around checkout, the biggest things in the infection control component is we're seeing guidelines regarding, like Christina was talking about with PPE, where we're taking that off, where we're removing it, where we're able to go within the practice while wearing PPE. But then also there's additional guidelines regarding separating off the front office area from the back as well to reduce that exposure. So if we're trying to minimize our front office from going into the back office and our back team members coming forward, how is it that we do this? So a lot of it falls down to what is it going to be with our communication software? How can we utilize communication software or even pre-appointing within the operatory to make sure we're able to clearly communicate without having that face-to-face that we're used to when we're able to walk a patient out and say, hey, this is what so-and-so needs. You're able to get them set up for that.
Right. Well, so can you talk a minute? Wendy actually has a question. Can you, either one of you, talk about what, I know, first of all, every state is a little different and we all have our own requirements of safety and what we're comfortable with. But can you talk about what you can't wear walking out with PPE, or what the requirements are with regards to PPE and coming into the front office?
Yeah, so a lot of, go ahead, Christina.
We're going to refer to the May 1st OSHA guidelines for this, because OSHA really is the ones who dictate more with bloodborne pathogen standards and PPE protocols, what we should and shouldn't be doing when it comes to our specific PPE. So there's lots of other guidelines out there from CDC, ADA, FDA, NIOSH. All of them have something different, but when we're referring to what OSHA is asking us to do for our own safety, because they're worried about the safety of the employees, they're asking that you remove your gown and your gloves in the operatory, and then you would have a designated spot, because it's an aerosol producing operatory, that you would then exit the operatory and you have a designated spot where you would remove any of your face shield, your goggles, your respirator. And if you continue to wear those throughout the day, if you decide that I'm going to do an extended use right now during extended use protocol, and I'm not going to touch these and I'm not going to take anything off of my face, then those are considered contaminated and they are to never leave a clinical area. And so your front office area is going to be considered a non-clinical space. So that's where that barrier comes. And some practices, the way that you're set up, you might have a perfect flow where you can still kind of do a handoff and be in a clinical space. But anytime you cross over to that front office, it's going to be a non-clinical space, and we have to create that barrier. And so that's where that flow is becoming a little bit funky, where it's like, okay, where can I go? Where can I not go? And I have all this stuff on. And so that's what the current requirements are for PPE wise.
So Chastity, we've talked in the past, one of the things we all agree on, if this was a perfect world, is if we could have a dental assistant floater or somebody clinical. We were saying clinical because they understand more of OSHA than a lot of front office team members in safety and health. But if we had a clinical floater, could somebody float from taking the patient from the operatory to the front office and do the handoff that way?
Yeah, in that situation, you're going to be able to wear PPE that's appropriate for interacting, which is going to be dependent on state-by-state guidance, whether or not they're recommending that you should be wearing masks, and then giving your patient direction to where it is that they would be going. So that would be appropriate because they're not in the full PPE gear that is for that aerosol exposure. And as well, if they are donning a mask, it's more in compliance with the public factors that lead to mask recommendations with the CDC.
Okay. So you just mentioned this, and I mean, one of the things that the teams could be working on better or right now is communication between the front and the back, excuse me, without having to go to the front or to the back, right? We have all this amazing technology out there. I know in my office, we wore walkie-talkies and we wore headsets. Now, if you're trying to figure out how to wear PPE, I don't think I would recommend also trying to figure out how to do walkie-talkies and headsets right now. That'd be way too much at once. But what suggestions, Chastity, do you have with regards, could we do pop-up messenger on our computers? Somebody asked me the other day about route sheets, and not that they wanted them, but should they go back to them? So what thoughts do you have about communication that way, Chastity?
Yeah, those are great to bring up. With the routing sheets, if you can go digital, that's going to be the best way to go. Or if you already are digital, that's the best way to be able to support this, because you can then send the messages from the back of the practice to the front or vice versa, especially if you're letting someone know, hey, I'm checking in so-and-so, they're here, they passed the pre-screening questions, whatever that may be. But definitely eliminating paper, because the lifespan that it will live on those porous surfaces is an extended period of time. So anytime you can minimize those contact touch surfaces for the cross-contamination standpoint, it's going to be best.
Okay.
You know, and same thing if it depends on the size of your practice. So if you're able to pre-appoint in the operatory and know that they don't have any balances due for insurance, you're able to then kind of dismiss them out of the practice without having to have that secondary interaction. And especially if your practice is smaller, you can give them guidance on where the exit is. Of course, that's going to change if you have a bigger practice with a more complicated layout or like multiple stations that they tend to stop at, depending on how many specialties are within the office as well.
Right. And we talked about this last week, and I actually haven't thought about this. So this is something new. I know we were talking about adding time to the appointments to give more time and then more turnover time, and to be able to transition patients so we're not like, you know, passing in the hallways, high-fiving, that kind of a thing. I'm also thinking this is a huge time for huddles to be a bit like, we could sit and go over every patient in the huddle the way we're supposed to be. But now we really could and be like, she doesn't have a balance. We're going to collect this ahead of time. Let's get them rescheduled for their appointment. Christina, have you been talking about huddles or giving kind of some thoughts around that?
Yeah, I think now more than ever, huddles should become part of your standard day-to-day operations. And the reason being exactly what you said. If we're trying to coordinate what we're going to do for checkout, you know, we easily can plan what it looks like when people are coming in, but when they're leaving is always a little bit more fluctuant, right? It's like, when do we actually just end right on that exact dot time? Not very often. Start time, sure, but end times, maybe not so much. And so, you know, to be able to have that flexibility and say, okay, you know, who do we actually have to collect payment from, and marking that out throughout the day and saying, okay, well, this is what that pattern looks like. Is that going to flow well? Are we going to run into any issues? Acknowledge, like, know the chaos in advance. You know, we've said this before, where we're like, plan for the chaos, like just have planned chaos. Know, like, okay, this is a problem. I've got 2 people that are likely going to need to check out at the same time. We can't have that happening. Who's going to go first? How are we going to already know this in advance? So that way it just looks, you know, more structured, and instead of, you know, having to deal with it at the moment where you go to bring someone up to the front and you're like, oh no, someone's there. We got to back down, you know, and wait for this person to go away. Having that plan really well. And then, like you said, really planning out who might already have existing treatment plans that we might need to go over so that we can have a plan for them. How are we going to have this conversation with them? You know, are they somebody who, you know, usually just needs like a quick, like, this is what we're going to do next time, and that's it, and I can already have that sheet ready to show them? Can I email it to them? Are they technical savvy individuals? Are they somebody who I usually need to sit down with and go through a lengthy process with? Should we schedule a separate time for them? You know, just having a plan for who are we seeing? What's, you know, where are the bottlenecks going to be? How are we going to handle these checkouts? And that way we can have that controlled chaos and have the plan for the day.